We have all heard that cardiovascular diseases are the cause of more than half of deaths on our planet. And then the question arises, what to do about it? How can you protect yourself? What actions should be taken to reduce this risk and to live happily ever after? In this video I will tell you about the basic things that everyone needs to know, and if you know these things and follow these recommendations, then you can rest easy. So watch the video to the end, it will be very useful and interesting. The first thing to understand is that there are actually no simple methods. There are a huge number of such loud headlines on the internet, then drink a decoction of this herb and your vessels will instantly clear. In fact, it doesn't work so easily and so simply. The health of our vessels is a constant, long-term preventive work. This is always a comprehensive approach and it is necessary to know the basic principles and follow a certain set of recommendations for a long period, then it works. And if a person has developed atherosclerosis and his vessels are clogged with plaques in such a way that the lumen of the vessel has decreased by more than 50%, then of course serious medicine is already involved and appropriate specialists should deal with this here. And then, even with treatment in these cases, the cholesterol plaques themselves do not dissolve and do not evaporate, they generally remain, they just become denser and this gives an increase in the lumen of the vessel. That is why it is extremely important to adhere to the prevention of atherosclerosis. And why, generally speaking, are the vessels clogged? Why is this happening? In fact, this process is complex, multifactorial and it has many reasons. For example, if we eat a lot of salty food, then blood thickens and fluid retention occurs. As a result, blood pressure increases. Or when we experience stress, we produce a stress hormone, this is adrenaline and a burrow of adrenaline, as well as cortisol, and this also leads to vasoconstriction and an increase in pressure. So that's the thing, that such situations in our life happen all the time. And every time we have such stress for the vessels, microtrauma is formed. As a result, the vessel receives a certain damage and in this place it swells and microinflammation is formed. Then the leukocytes in this inflammation begin to accumulate. And that's where the famous cholesterol comes into play, because it also begins to actively stick to this place, forming a cholesterol plaque. And if you have formed a cholesterol plaque, then you will not get rid of it so easily. That is why an integrated approach is important both in nutrition and in lifestyle and physical activity, and on many other points it is also necessary to know what to do. So what is cholesterol? Simply put, there is good cholesterol and bad cholesterol. The good ones are high-density lipoproteins, the bad ones are low-density lipoproteins, and they are antagonists to each other. If you go to the clinic and get tested for a lipid profile. By the way, I recommend this to everyone. It's not difficult, it's not very expensive and it's just necessary to know what's going on there with cholesterol. So, if you take a lipid profile, then you will see the following picture, there will be written total cholesterol, as well as the content of high-density and low-density cholesterol, that is, good and bad. And how to analyze it? Previously, doctors said that a healthy ratio is 3:1. Now experts say that this is not the highest quality indicator, because there is a more accurate index, this is the atherogenicity index. And it is calculated as follows. Total cholesterol is taken, high-density cholesterol is subtracted from it, and all this is divided again by the high-density cholesterol index. And further, the lower the coefficient, the less likely it is that you will develop atherosclerosis. But here a very interesting point arises. The thing is that if you have a good atherogenicity index, this does not guarantee that you will not have cholesterol plaques. Conversely, there are people who have a poor atherogenicity index, but there are no cholesterol plaques anyway. Why is this happening? In fact, the atherogenicity index is just one of the factors. It is certainly the most significant and shows the most likely picture, but it is not the only one. And another significant factor is blood pressure. What I mentioned in passing at the beginning of the video. In addition to how much cholesterol you have in absolute terms in your blood, it is also important what your blood pressure is. That is, in order to maintain your blood vessels in a normal healthy state and to be sure that you are not in danger of cholesterol plaques, you need to remember about these two most important pillars. The first is your atherogenicity index and the second is your blood pressure. And now in more detail about how all this can be effectively influenced to be healthy and happy. About cholesterol. Of course, it is desirable to limit animal fats. Do not abuse greasy steaks, do not abuse butter. Some people say that cholesterol is actually produced by our body anyway, so there is no point in limiting it in our diet. These people are not quite right, because it has been scientifically proven, and it's just a fact, that if you limit the intake of cholesterol with food, then your total cholesterol decreases by 20 to 30%. That is, if you have measured your lipid profile and see that your total cholesterol exceeds the norm by 25%, then just with the help of a diet, you will very quickly, within 1 or 2 months, bring your total cholesterol to normal. But one diet is not enough, you need to maintain healthy blood pressure. How to do it? Firstly, of course, physical activity. Because physical activity is the best way to throw such a substance as nitric oxide into our blood. Nitric oxide is a unique compound that really heals our body. It just really makes us healthier and allows us to live longer. Unfortunately, it is almost impossible to use nitric oxide with pills. It breaks down very quickly, and therefore the most natural, normal and healthy way to extract it is physical activity. The World Health Organization recommends at least 150 minutes of moderate physical activity per week, or 75 intensive. Intense physical activity is when your heart rate exceeds 120 beats per minute. Moderate physical activity is when, for example, you walk with a brisk step. Again, these are not recommended, these are the minimum values, that is, to fulfill at least this standard, but of course it is better to have more, if there are opportunities. Nitric oxide has an amazing effect on your body, and it instantly reduces your blood pressure and dilates your blood vessels, and of course, as a result, it heals and reduces the likelihood of cholesterol plaques. Also, the formation of blood clots will be greatly influenced, as I have already said, by the increased consumption of salt, as well as sugar. Therefore, in addition to the fact that you should not abuse animal fats, you also need to consume up to 4 grams of salt per day and minimize sugar if possible. Ideally, do not use sugar at all, in principle. Although I understand that this is impossible in our life, but the less sugar you eat, the better. And there is another very important thing about our blood pressure, which I just can't help but say, because so many people don't know this, but please take this into account. Firstly, if you have never measured your blood pressure, then measure it, it will be useful to know. Secondly, almost always people measure pressure incorrectly. Even if you come to the doctor and it would seem, well, the doctor should understand what he is doing. To be honest, I don't know why doctors do this, but as a rule, they also measure blood pressure incorrectly. Well, most likely they can be understood, because there is a rush, because there are still many other patients, and therefore it can be done so simplistically, approximately by eye. Well, yes, in practice this happens. As people usually do, they put on a tonometer, sat down, immediately measured and calmed down, as if they had learned the correct result. So no, the result will be incorrect. And how to measure it correctly so that the result is accurate? It is measured as follows: in the morning, before getting out of bed, that is, as soon as you wake up, while continuing to lie in bed, you take a tonometer and put it on your shoulder. You measure the pressure and remember or record the result. Then you rest for 5 minutes lying down and relaxed, not thinking about anything stressful and not moving much, but just lie down and relax for another 5 minutes. After that, measure the second time and also remember the result. Then rest again for 5 minutes and measure for the third time. And only then from these 3 measurements you make the arithmetic mean, and this will be your true and accurate pressure. You can't measure pressure when you're sitting. You can't measure the pressure when you walked before. This will not be the exact result. Moreover, I do not recommend using electric tonometers, they give a very large error. You need to measure with a manual tonometer. I assure you, even when you measure the pressure 3 times in a row under ideal conditions, all 3 times it can be quite different, even with a manual tonometer. So friends, summing up, in fact, the secret of healthy blood vessels is very simple to understand. Firstly, you know your lipid profile and your atherogenicity index. Secondly, if you have an increased atherogenicity index, then consume less animal fats. You can also add omega-3, it has a great effect on the lipid profile. But the atherogenicity index is only one of the factors of the development of atherosclerosis. Physical activity is also necessary. Minimize salt and sugar intake. And you know what your blood pressure is. This is the most important thing you need to know about your health, because it is the cardiovascular system that determines how long and well we will live. It is very important. And if you liked this video, then like and subscribe to my channel, and see you on my other videos. See you later.